we three got to Methodist Hospital in 1987, it was already a great hospital. It was already noted because of its medical staff and its nursing care more than anything else. So our first job was not to screw that up. We used to say Methodist was demographically blessed because we were out there in this medical center, the population was moving this way, and we were benefiting from that demographic growth, that population growth, and more doctors and so forth. So we had that going for us, but we were still just one hospital in one place. We were in a market with Baptist that had several hospitals, Santa Rosa that had several hospitals, and so we had to have more outlets, more access points around the community.
Methodist was on the brink of not surviving. And then if you don't survive and you get in that situation, then you're just kind of going to the highest bidder, and who knows what that is. And you have no say-so about what about the future.
We had pretty much maxed out the debt capacity of Methodist Hospital, so we weren't going to be out building more Methodist hospitals. So that first strategic plan in '89, the number one strategy was partnerships and collaboration. We began on about a 4-year journey of talking to everyone else in town, the nonprofits, about that, and we went down some blind, and after 3 or 4 years, you would have thought that we couldn't partnership and collaborate our way out of a wet paper bag. But then in 93, 94, as the Humana hospitals were sloughed off of Humana and then acquired by Columbia, which became Columbia HCA and then HCA, that changed that landscape. And when that opportunity came to us in 94, I think the only reason we were able to conceive of it and the board was able to accept the idea was the fact that we had been down all these other blind alleys, so we knew what either was or was not possible with Santa Rosa, with Baptist and so forth. And I think if we had not done those things in the earlier years, we would not have been prepared to make that decision to negotiate with HCA.
It's one thing to find a partner to do an agreement with, and it's a different thing to find a partner to execute the agreement and basically live with day to day. And at the same time we were doing all this, within a few years there was a massive cultural change at Columbia. It went from the deal-making, the gunslingers, to the HCA personality. And the timing of that was just right and healthy for the partnership.
It was interesting to me for them to appreciate the mission that we were following and using as guidelines, and the way we thought about issues differently than they. The partnership was really, I mean, I thought, aside from the astronomically successful and wonderful outcome, we never had a problem of a difficulty with our partner.
I think they saw it as an opportunity to take a hospital with the reputation, with the culture, with the mission, to merge efforts with in the form of the partnership. And it was that culture and that reputation and that leadership, frankly, starting with John Hornby and the wisdom of our board, that was very appealing to them. And I think they did some things and agreed to things that they might not otherwise have agreed to, which have made this partnership that much more enduring and lasting in terms of its success and its functionality and its purpose and its continued mission, which is strong and evident and pervasive.
This was not only financially driven, services driven, size and scope driven, but I'd like to think, and I think we'd all agree, that this was mission driven. We placed on every document, every business card, every letterhead, on our name badges, serving humanity to honor God. That was our mission. And we did the same thing over on the Methodist Healthcare Ministries side, serving humanity to honor God. So no one could confuse the missions of either organization. Seemingly equal, yet this one on one side was doing so much more in the community, and this one on this side was doing so much more from a healthcare perspective.
Even though a lot of the physicians had a really hard time with the concept of the for-profit, I think paired with the mission of Methodist Healthcare Ministries, they felt okay about it, because what Methodist Healthcare Ministries was doing was taking profits and putting them back into the medically underserved. And I think that was, I've heard a lot of physicians tell me that, as a matter of fact, that they feel good about practicing at Methodist because they know that ultimately a lot of the profits from the system go back into the community.
We started to focus and aligning our priorities. Let's raise the quality, and it was proven to us from HCA that you're going to actually financially benefit, which drove us to also say we've got to use our proceeds to help those that don't have access to health care.
I think
you were able to find for us the nonprofit expert that raised the issue, can we have a operating entity that owns a for-profit entity and more taxes him? It's a one of a kind. The IRS has never approved anything else, and we wrestled with where we're going to go. The first thing that really came to mind was a Wesley nurse program.
We had these two things happening at the same time. We had all of these Wesley nurses, we had the clinic structure, we had all of our relationships now beginning with FQHCs, federally qualified health centers, and our strategic planning processes every 3 to 5 years looked at our successes and built on it, and then the revenue created by the partnership started to provide us with the ability to do more and more and more and more.
I had the privilege of being able to come to the board meetings of Methodist Healthcare Ministries for over 11 years while I was the CEO of Methodist Healthcare System, and I would give the report on the state of the system to Methodist Healthcare Ministries board, and I got to listen to the great things that took place there, and it really made me very proud. And I will tell you that it made me a better CEO of the Methodist Healthcare System because I really connected the dots that the better the system gets and the better quality we have, the happier the patients are, the happier the doctors are, and the doctors want to bring their patients, and eventually the higher the margin is of that system, the more good Methodist Healthcare Ministries is going to be able to do.
And now we're in all the counties in the South, now Rio, Texas Conference, and it's just beyond our imagination.
And it's been God that got us there because we didn't know what we were doing. We had some good ideas, some worthwhile thoughts, but I mean, it's like we didn't have a plan.
it's just been a sight to behold, and it has been one of life's great pleasures to think about, and one of life's most meaningful things, to me at least, to think about all the people that are served, have been served, will continue to be served, that otherwise would not have been served. And that's heartwarming and meaningful and inspirational.
I remember having many conversations with board members about, well, where is this going to go? And my answer to every one of those questions was, well, it's going to go wherever we take it, both as a board and a staff, in conjunction with everything that was being done at Methodist Healthcare System. And so the success of one became the success of the other. So for me, it was an amazing journey of trying to ramp out these resources to the least served unfunded patients of our area, which continues to this day.
It took me a long time until I finally realized, working with this organization, the compensation is the work. And that if you feel good about what you're doing, you don't need any other kind of compensation.
The key thing, which makes me so confident that our future is bright, is the board of both Methodist Healthcare Ministries and Methodist Healthcare System being as passionate as they are. We have the right people on watch, and they have the right core values in their hearts. So I think that passion and that know-how is going to keep us safe and take us forward.